So Lois, over to you. I will hand you.
Good morning. Can you hear me? It's the first thing. Yes, 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 it's good. That's okay then. Right, I'm just going to share my screen and hopefully that will work, because then I'm going to disappear. Oh no, I'll disappear to you. Is that, oh no, hang on, that one. Is that working? Yep. Yeah. Okay, lovely. All right. Okay, so Stacey asked me to talk about continence and whether it's a problem and what we do about it. As I said, as Stacey said, I'm quite happy for you to ask questions as you go through. If not, save them up. We'll do them at the end, whatever suits you best and what's easier for you. So my name is Lois. Yep, it does work. Okay, so I work with the Metro South MND service. So we've been going since 2013, and we look after all the clients who attend the PA hospital. Okay, so if you're in Metro South at all, or out West Moreton, Darling Downs, that way, and you come into the PA, we will see you in clinic. But our community team are very much, we just look after people who live in Metro South. And we are a multidisciplinary team. So we're a one-stop shop for over 65s for the whole of your journey. For your under 65s, we liaise very much with your NDIS providers. And we're a two-stop shop. So you get you get social work and you get nursing, and all the others come under your NDIS plan if you're under 65, okay? But our aim really is to provide an ongoing proactive service throughout the whole of your journey. So we've seen a lot of things over the years. But continence is one of those things that when we first started doing MND, people said, not an issue, you don't need to talk about this. But then clients started saying things to us, and we thought, actually, maybe it is an issue for a number of reasons. So this was one of the first ones we had. I had a weak pelvic floor giving birth. This was a 32-year-old lady, I think she was. But surely I shouldn't need to needing pads for a full wee. I had no incontinence before I had MND. And was told it wasn't going to be a problem. It's now a problem. My husband's struggling with changing pads. Whoops, my fall was when I was trying to get to the toilet. So for a variety of reasons, it's a problem. So we have a number of different types of incontinence. So incontinence is a word that we associate with not having any control over your waterworks at all, okay? But it can be for other reasons as well. So we have stress incontinence. So just to qualify those definitions, so stress incontinence is where you leak during activities. So it causes an increased pressure inside your abdomen. It pushes down on the bladder. Most common with sneezing, coughing, lifting. Sometimes when you're anxious, if you're constipated, if you're a bit overweight, that can also have a part to play in that stress incontinence. Then we've got incontinence associated with chronic retention, okay? So that's where the bladder just can't empty properly, okay? It causes leakage, causes variable for that one, but some of the things that cause it are damage to the nerves, okay? So in MND, we say that we've got problems with the motor nerves, but not other nerves, but the urethral sphincter, the pelvic floor muscles, some other medical conditions have all identified that there are problems with the nerves with the bladder, okay? So sometimes it's an issue, sometimes not. Can also be caused by some medications, can cause retention as well. Then we've got functional incontinence. So that's due to poor mobility. So this is the most common one in MND that we get. It's due to poor mobility. It can be because of your eyesight, can be because people have got some dementia, can be environmental factors, anything that makes it difficult to get to the toilet in time, okay? And that's the most common one that we see. Okay, and then the other one that we do see is an urge incontinence, where there's a sudden, strong need, you've got to go, and when you got to go, you have got to go, okay? But it actually where the bladder feels a lot fuller than it actually is, okay? And what that means is when the bladder feels full, it contracts a bit too early when it's not very full, so you just get a little bit of leakage, okay? It's definitely linked to some of the other neurological conditions, not being as linked particularly with MND, but you do see it at times, okay? So that's the different types that we're looking at. So this is what we've seen, knowing you need to pass urine, but you've got no control. can occur when you're at rest, not with necessarily moving, hoisting, coughing, so it doesn't appear to be a functional or a stress incontinence, and it's not urgency. Okay, so for whatever reason, it's happening. So just to remind you what your anatomy looks like, and when we're talking about the bladder and the bowel, where it is. So on your chaps, does my mouse work on the share screen? Yeah, okay, all right. So for you guys, there's your bladder, there's your prostate, okay, and there's your urethra, okay? Your bowel sits behind your bladder, okay? So this is when we talk about some other stuff later on, it will come into play, okay? There's your pubic bone at the front, and your pelvic floor runs all the way along the back, on the bottom rather, should I say. So for your ladies, okay, bit more anatomy in there. We've got a uterus stuck at the top there as well, okay? So you've also got your bladder, your pelvic floor, and your bowel runs behind the two, okay? So that's just to remind you where it sits, because it is relevant where it sits when we're talking about MND, and when things happen. So from a nerve point of view, okay, so when we started doing MND, we were told, again, never a problem. No motor nerves affected with the bladder, so why should it be a problem, okay? But actually, there is a motor nerve. There's this big nerve here called the pudendal nerve that is actually a motor nerve, but it's under your voluntary control, which is what makes it a little bit different, okay? When your bladder fills up and it empties, okay, that's under an automatic control. It just automatically happens. There's nothing you can do about that, okay? But the external sphincter, this bit here, okay, at the bottom of your bladder, okay, that's under voluntary control. So you can stop and start a wee when you want to, okay? But that nerve is controlled by a motor nerve, okay? So in theory, if this motor nerve starts to get affected in MND, that affects your ability to control your external sphincter and when you want to wee, and that's why you tend to get some leakage. Okay, does that make sense? Okay, so together with that, we've also got your abdominal muscle, which runs down the side there. It's hiding under your pictures there, your lovely smiley faces there on my screen. But you've got your abdominal wall there, and you've got your pelvic floor, remember, down the bottom, okay? And they're also controlled by motor neurons, okay? So if they're affected as well, that will also have an impact on this, okay? So there is an assumption that motor nerves are involved in continence when it comes to MND, okay? The position your bladder also lies in can be a problem. So going back to that slide with your anatomy, okay? If you've got a lot of weight that's squashing down on your bladder, or just when you're sitting and not moving around as much, everything's just that bit more squashed up when you're sitting down. If all your other weight is pushing down on your bladder, and depending where the positioning it is, that's also going to affect it, okay? So there's a number of things that actually, motor-wise, which is what you'd expect in MND, and physical-wise, that lead to this incontinence that we see, okay? So, vaguely we've touched on some of this. So the urge incontinence, okay, could be related to chronic retention. I'm just going to make it smaller, okay. Or it could be related to chronic retention, could be related to either, okay. We've already shown that the motor nerves do have some problems, okay, and don't work as well. That loss of motor control, okay, so if that motor control is not working, it's not going to control that external sphincter. Fasciculation of the bladder muscles, okay. Now, you know, you've all, not all of you, some of you may have had that fasciculation, you know, where your muscles are twitching up and down under your skin and you can feel it. Now, fancy name fasciculations, okay. Often get them in arms and legs, okay. But you can actually get them in the bladder muscles and in the abdominal muscles, okay, and in those surrounding muscle groups, okay. And we think, anecdotally, we've seen it, that people who have a lot of abdominal fasciculations tend to have more problems with their incontinence, okay. And then we've talked about the muscles from the surrounding groups, okay. So all those other ones, the truncal weakness seems to be the common denominator. If you're somebody that has a lot of truncal weakness, seems to be a more of a predictive pattern that you're going to start having some problems with your incontinence. If your abdominal muscles are weak, likely the pelvic floor is going to be weak. and then that affects those pressures of that valve closing, that external sphincter opening and shutting. Okay. Poor positioning. So again, where your bladder is, okay, if you're sitting at a funny angle, okay, and you've got more weight, or you're kind of leaning forward and you've got more weight again pushing on that bladder, that's not going to help either. Okay. So all those things tell us it's going to be a problem that we need to think about. Okay. So what we're going to do about it, it's fine saying it's a problem, but what we're going to do about it is the bit that's relevant for you guys. Okay. So first thing we'd want to know is, have you got any previous bladder or bowel history? Okay. Anything wrong that you've had before? Anything that's going to predispose you to having a problem? Okay. Have you had any surgery before anywhere down there? Okay. What's your bowel history like? That's really important as well. Okay. Constipation will also cause problems with incontinence. So think back to that picture that I just had where your bowel is at the back. If your bowel is full because you're constipated, that's going to press on that bladder as well. Okay. And again, if that external sphincter isn't working as well, you're going to leak. Okay. So we don't want you constipated. Okay. So when does it happen? Is it daytime? Is it nighttime? Is it that stress? Is it when you're doing something? We want to know that stuff. Okay. Is it leakage? Or is it a full week? Are you getting pain? Is it an urgency? Is it a hesitancy? How often do you go? We're looking at other causes. We don't want to just presume this is because of your MND. Okay. There are other causes of incontinence. Have you got a urine infection? You know, if it's come on suddenly and you're leaking and it hurts and you're getting frequency, it may be that you've got a UTI. Okay. If it's come on slowly, could be something completely different. Okay. So there's lots of different causes for it that we want to exclude all those other ones as well. Okay. So that's part of our history, just not making the presumption. So that comes in with that sudden onset or gradual onset. Looking at your fluid intake. Okay. A lot of people who think, I don't want to wee, I don't want to leak, don't drink. Okay. That actually makes it worse. Okay. You need a really good fluid intake. If your urine is really concentrated, okay, if you're not drinking enough, that actually irritates the bladder and makes you actually want to go more. Okay. So it's really important that you actually do have a good quantity of fluid. Okay. That will also stop the constipation, which will stop that problem. Okay. The other thing about constipation that we really don't want is if you're straining, again, you're going to strain, you're going to stretch that pelvic floor more often, and you're going to weaken that pelvic floor, which is going to make it worse as well. Okay. And then obviously your mobility challenges. What is your issue that means you can't get to the toilet as quick enough? Okay. So that's what we would do when we come in. So any nurse would do that. Occupational therapists would do some of that as well. I'll just let somebody else in, by the way. So all of those things that we want to know, what is the issue that you've got in order for us to manage it correctly? Okay. Okay. So things that we would want to help you out with. So a good toileting routine, going regularly. Don't hold it. If you need to go, go. Okay. Try not to, having said that, try not to go every 2 minutes. Okay. So make sure you go when you get up in the morning, you know, have a drink, go half an hour later. Keep a good toileting routine. Okay. One of the other things that's really good to do is to, particularly if it's a functional issue, is to go to the loo every time you do another transfer. Okay. That cuts it down in terms of how many stand-up, sit-downs you've got to go. If unfortunately you're at a level where you're needing to use a hoist, that helps you carer, is that, you know, you get out of your chair, you go on the toilet first, then you go into whatever wheelchair, bed, whatever you're moving to. Okay. So you always do a toilet stop in the middle every time you do a transfer. Okay. That reduces your other transfers at the same time and keeps you into a good routine. Okay. It also takes out that urgency if you're regularly going, so your bladder isn't getting full, not going to get squashed as well. Okay. But it's keeping it in place with that. Okay. Other things, take a spare set of clothes when you go out just in case. Okay. We often get caught short. There might not be any toilets about. Okay. Hopefully, I can't see any of you right now, so I'm just going to go on. Stacey's nodding or not. is a toilet map. I don't know how many of you have come across the toilet map. You can get it on an app, you can get it on a website, okay? But it will actually tell you where all the public toilets are, okay? Really useful app to have if you're out and about, so you know where the loos are, okay? Equally, go before you get in the car. Go when you get out the car if there's a toilet there, okay? Make sure you go frequently. All that regular planning, okay? But that's a really good, handy one to have, okay? Get rid of your caffeine, guys. I know we like a caffeine hit. I'm a particular caffeine addict in the morning, but cut it out. Caffeine does irritate the bladder, okay? And makes you want to go more frequently anyway. So cut it down. That's going to help, okay? Commodes, bottles. So that's your functional stuff to have at hand. You know, if you've got a functional issue where you can't get to the toilet as quickly as you want to go, get a commode, okay? Put it by your bed, put it by your chair, okay? You can just do that one transfer and then you've got to go, okay? You can do that one transfer, then back again, and you're not having to stress, worry, anxious, can't quite get to the loo in time. If you don't need to use it and you've got plenty of time, that's fine, but it's there. Really useful at night, okay? When you want to get out of bed, but you're a bit disorientated, limbs are a bit stiff or a bit floppy, depending which way you are, okay? Or you've got to depend on carers. Have a bottle by the bed, okay? Have your commode by the bed. Takes out that anxiety and stress in the middle of the night, okay? When you're a bit tired and things aren't working quite as well, okay? They're all things that will help, okay? Mentioned hydration earlier. Ideally, we should be drinking 2 to 3 litres a day. Don't freak at that one, okay? But we need to have that amount of hydration. That will help your bladder work well, okay? That will also stop your or reduce, I'm not going to say stop, reduce your constipation. You keep well hydrated, okay? So those are all the things that you can do that's also going to help it as well, okay? All right with that? So yeah, okay. All right, so then we look at all the different aids that are available. Now, this is where it becomes a bit of a minefield, doesn't it? If we're looking at pads, what sort do you get? You go in the chemist and there's hundreds of them. They're all different sorts and sizes and they tell you different things and what do they actually mean. So, you know, you've got absorbency, you've got size, you've got shape, you've got what you're going to use, you've got pull-ups, briefs, slips, liners, shields, pads, all sorts of other things. What the heck do they mean, okay? And where do you start when you're looking at this, okay? And nobody wants to use them. Let me remind you that. You're not on your own. Nobody wants to have to resort to using pads, but unfortunately, it's one of those things that comes to most people at some point in time, okay? So this is some of the different sorts you've got. You've got pull-ups, so they're like your full underwear. You've got liners, slips, they're called. Form, I think, is another one that they're called, that just go in your undies. You've got these new fancy ones that are called elastic. So they're almost like a belt that comes around. So it's just got a front bit, and then it's got this belt that comes around either side, okay, that does up at the front, that you can also then undo and let that down if you want to, okay? So that's an easy on-off one if you're sitting, but you don't actually want to use your pad, especially you guys, it's easy. And you can't see this one down here I'll struggle getting pictures of these that will make nice and clear. These are the ones that I'm going to call them nappies because that's what everyone calls them, nappies. They are actually called slips, okay, but they've got the tape on the side, okay, so they're a bit full all the way around and they've got tape on as well, okay. That's generally your 4 different groups, come in all different shapes, size, absorbency, whatever, okay. So there's a number of things to look at when you're looking at choosing what you're going to use, okay. One is how functional are you, okay. So people that are still out and about might get caught with a bit of urgency. Sometimes we might just get a liner. We might just get a thin pad to start with, okay? Or we might find that actually using a full pair of undies is better. So if you were sitting on I was going to say sitting on a plane for a long plane ride, but you know, none of us are doing that at the minute, are we? Whether you want to get able to or not, okay? But you might find that wearing some pull-ups is easier, okay? Whole undies, okay? Sometimes for carers, the pads the ones with the tape on, easier because you can do them when you're lying down in bed, fold them up, do them up again, okay? If you're still independent and you're still able to use a bottle at times and it's just a backup, sometimes people like these elastic ones, so you can pull the front down when you want to, okay, and just insert a bottle and do it that way, okay? So there's lots of different things you're looking at when you're choosing what pad to use, okay? The best thing I can say to you is your nurses and your OTs are the experts at this, okay? They can talk through with you which one's going to be the best for you, which is the best one for your carers, what stage you're up to in your disease process or incontinence level, and what's actually going to work best for you, okay? So it is a bit of a minefield. Then we've got sheaths, okay? Now this is a guy-only option, girls, okay? Sorry, but it is, okay? However, you've got to have a good carer at the same time as well, okay? Because the knack of sheaths, they do work, but you've got to put them on right. And you don't want to be too hairy, otherwise you need to be shaved, okay? But it's basically an external condom that goes on the penis and attaches to a bag, okay? I have had some people that use these, okay, successfully. I have also had some people use these very unsuccessfully, okay? The difficulty with these on is two issues. One, if you don't put it on, it's going to leak. So you often find you end up wearing a pad as backup just in case. If you move awkwardly or it gets twisted down your trousers, down your shorts while you're in bed and it gets twisted, then it will leak as well, okay? So some people really don't like these. If you get to a stage where you're permanently in bed, not moving, probably the best time to use them. While you're still up and round and functional, more likely to have issues with them. But it's an option. Everything is an option, and everything is something that you can try. Does it work for you? Yes, no? Give it a go. Okay, there's no right and wrongs in this journey. It's trying everything. What you find is your best solution. Catheters. Okay, catheters are something that we don't tend to use very much in MND. Okay, partly because there's two issues with catheters. Okay, one is that there's a high risk of infection. Okay, it's going internally, and we don't want you getting lots of infections. Okay, and that's a predominant reason that we don't use them, along with the fact of trauma. Okay, if your catheter gets caught while you're being lifted and moved awkwardly, okay, it's gonna hurt. Okay, and we don't want that. Okay, so urine infections and trauma are the biggest two issues with these, and again, they can leak. Okay, like if you get it twisted, if you get it trapped, it can leak, and then the only way you can unfix it is you've actually got to have to change the whole catheter. Okay, now with people that are over 65 with My Aged Care, okay, you can get some of the nursing services will come out and change your catheters for you, okay, because they need changing every 6 weeks, and that's the other thing. Okay, NDIS, much easier. You can get nursing services on NDIS now that'll come out and change them for you. Okay, so that's not such a big issue. Used to be prior to NDIS, not now. Okay, so again, it's another option. People that tend to have catheters tend to be the people that go into the chronic retention. You just can't pass wee, okay, for whatever reason. That's the people that tend to have them, okay, because otherwise you end up with urine left in the bladder and it just doesn't empty properly, and that causes problems of its own, okay, and you can get lots of dribbling and all sorts. So they're the people that tend to have the catheters mostly, okay, otherwise they tend to be avoided. Okay, other things that you can also use, this is all backup protection, okay, just in case. We've got the blueies you probably might have seen, okay, these are what they tend to use mostly in hospital if you go in. You can put them on your bed, you can put them on your chair, just as an extra layer, just in case. So if you're not at a stage where you want to wear pads, but you want to protect your chair or your bed just in case, they can work. These are just disposable, okay? You just chuck them out again, okay? You've then got the Kylies, which are the ones that go across the whole bed, okay, that you can use in bed. Again, backup, if you just want to just back up, or you can use it, you know, just in case. Some people will use it as a pad because they're not really confident whether the pad's going to hold enough urine. They'll put something in the bed like that just to protect it as well, okay? But these are just quite soft and comfortable, okay? And these are just smaller versions. These are chair pads of the same Kylies, okay? Same thing, just as a backup, have it in your chair just in case, or if you're not confident that your pad's going to hold away, especially when you first start using pads, it's a bit scary because you think, are they going to leak? Are they not? Are they going to hold everything I'm going to use? Need it for, okay? So these are just backup stuff that you can use as well, okay? So I guess you've got these products, but what else can we use? So we've talked about, we mentioned earlier, we have male bottles. Everyone knows about male bottles. Milk bottles work really well as well. Just chop the top off a milk bottle, okay? Just make sure it's not too sharp. But they work as well, and you can just dispose them and chuck them out, okay? But you can get your ordinary male urinals as well. But did you know you can get female ones as well? Most people forget you can actually get female urinals as well. Often used with an extra protector in the bed just in case, or on the chair. Okay, girls don't seem to be quite as confident at using these, and we don't see them very often, but you do occasionally. Again, with both of these, if you've got reduced hand function, you've got to be able to have the strength in your hand to hold it, okay, or have a carer that can do it for you either way. Okay, we don't want to be using these and then go and drop them everywhere. That wouldn't be great either. Okay, so you need to be able to have the strength in your hand to hold it, or happy to let your carer do it for you. Okay, then you've got your bedpan. Some people use these. Okay, again, don't see them very often, but you do. Okay, especially at night, or if you're somebody that's staying in bed for a lot of the time. Okay, can work just as well if you really don't want to wear pads as well. Okay, again, you need good carers, and it's helpful if you've got some mobility to be able to roll on and off them, but there are other options. Okay, remember, everything in MND is an option. It's for you to try it and work out what works best for you, because you're all individual. You've all got different needs. Okay, and of course, who pays for it? always a question. Okay, so I would suggest, if you are able, is you can get referrals to the continence services. Okay, most of Blue Care, Ozcare, the big agencies like that will have a continence advisor. They can come out and talk through it with you as well. What's going to work best for you. Okay, they are also the people that, if you are over 65, will very nicely fill in your mass forms. So if you're eligible for mass, you can actually get your pads through mass. Okay, and they will deliver you 6 months worth supply. Okay, the difficulty with that is, to some extent, you have to go for the worst case scenario, because mass will only give you 6 months worth. If you order, say, a light pad for 6 months and your needs change somewhere in that time, they're not going to swap them over for you. You've got to wait till your next review at 6 months and get the next lot. Okay, which potentially can cause some issues. Okay, so you can do that. The only catch to that, mass have now got a pot of, they're doing a palliative care funding projecting at the moment, and if you're under palliative care and do it through that, there's a bit more flexibility, and they will swap and change device pads for you. But generally, it's a 6 month block, and that's what you get, and that's what's got to last you. Okay. If you're NDIS, easy, they'll just pay for it. Okay, you can get that in your plan. And that's in there as well, so you can do that. And a lot of the chemists will do standing orders for pads. You can get it delivered and they'll just bill your NDIS planner with your money as well, so that one's an easy one. Okay, going back to your over 65s, I forgot to say, if you've got a package, okay, so if you've got your level 1 or level 2 package, you can get a top-up payment that will pay for continence aids. Okay, with a level 3 and 4, your pads and everything have to come out of your package. Okay, so it works a little bit different where you're at. CAPS funding is a scheme for people that aren't eligible for NDIS. They're not eligible for mass. They've not got DVA or any other eligibility criteria, and it's just a funding, and I think it's something like $540 a year that will pay towards your pads. Okay, but that's the people that really are just not eligible for anything else. Okay, so that one's there. So you don't see that very often, but occasionally some people fit into that category. Okay, so generally there is somebody out there that will pay for it for you. Okay, and cover the cost of it. Okay. And I don't want us to forget the psychological impact of continence. Okay, it's fine us going through this stuff. This is what it is. This is how you deal with it. But actually, it adds a whole nother level of stuff that people have to deal with. Okay, it can be seen as a marker of your disease progression. You know, you're not as functional as you're able, so you're now getting continent and you've got to wear pads, and that sucks. Okay, it can lead to anxiety, frustration. You can be anger, grief, depression, all those normal emotions that people get when they have any change in your journey. Okay, you know, there's different parts in MND where it kind of hits a reality, and continence, I think, is often one of those issues. You know, nobody wants to be dependent on anybody else for something that's a normal part of living. Okay, and it's just another one where you have to feel dependent on people. You've got problems with your body image. People start to get anxious about going out and doing things and socializing. You know, I've got a pad on and somebody's going to be able to see this and it doesn't look right and I don't want people to know about this. Okay, takes a while to adjust. Okay, certainly within your relationships, people don't like wearing pads. You know, it's just another change. Okay. It can also cause a problem for your carers in the fact they can start to feel overwhelmed. Okay. It's another change. It's something else they've got to deal with for you. You know, they've got to now worry about making sure you've ordered them and you've got them in the house, and how do we change them? And if you're not very mobile, how do we change your pads? And when do we do it? And is it going to last for a full week? And is this pad going to last all day? Or do we have to change that as well? So your carers can actually get quite overwhelmed with another level of care that they have to give you as well. So we need to take that into account as well, and how to manage that. Your financial burden often worries people. Hopefully with those eligibility criteria, it's not so bad. But, you know, there's always that bit about, you know, who's going to pay for it, and that can worry people. Okay. Increasing time cost spent on cleaning, clothes and bedding. That one's not included, and anyone's going to pay for that. That's just normal stuff, okay? But it can, you know, if you're worried about you're going to leak, your pads are going to leak, that makes more washing, you know. Is it going to smell? Do I need to do more washing? You know, is it going to leak? Do I need to do more washing? That takes time, okay? Do I need to have extra sets of bedding just in case? Do I need to have extra sets of clothes to take out with me just in case? You know, it all adds extra time, okay? So it has this big psychological impact on people, okay? And as I've just said, the time, confusion, ordering products. Who's going to help you with that? Have you got somebody to help you with that? Hopefully you do, okay? But there's a lot of products out there and getting confused, and what am I going to get? And all this stuff has this emotional impact that you have to deal with on top of everything else, okay? So it's not something that we take lightly when we talk about it, okay? It's something that we do understand. We know there's issues, but equally verbalize your issues. Talk to the support people around you, okay? If you, they say a problem shared is a problem halved. I'm not quite sure that quite goes with MND, but you know, it is that verbalize it, because stuff that you've got going on in your head where you might think it's a problem and you can't possibly imagine how you're going to overcome this and deal with this bit, there's often a solution. Okay, often clinicians such as themselves, Stacey, we've seen it before, we've seen it with other people. You know, we get a lot of our solutions from watching how you guys sort things out. Okay, and often we can see how somebody else has dealt with it in order to help you with it. Okay, so share it, talk about it, let's sort it. You know, what we don't want is you restricting what you do because you're worried about your continence. Okay, we want you getting out, we want you to be able to do everything you want to do, we want you to have that good quality of life as much as you can do for as long as you possibly can. Okay, don't let this stop you. Okay, and remember, other people other than people with MND have problems with continence, and you don't know about them. Okay, lots of people may have an issue, but you don't know about it. Okay, it's not everybody's going to look at you and say, you've got a problem with your continence. Ha ha, we know, because they don't. Okay, it's your problem, it's personal to you, it can be dealt with nobody else apart from your carers knowing about it. Okay, but let's not forget, it is part of MND, and it's another bit in that journey. And that's all I've got to say, because I could wrap it forever, but I'm not going to, because that's boring. But if you've got any questions.
Yeah, that's not what I thought you would be doing. I unmuted everyone but myself, which wasn't helpful.
I was going to say.
Thank you very much for that, Lois. So we'll hand over to the rest of you then. Does anyone have any questions at this stage? No? No questions at all?
Lois, I guess it's just really good to just have an affirmation that it can be a part of MND. I started to think I was a bit unique.
Yeah, and I think that's what we very much found at the beginning when we first started our service back in 2013. We read everything about MND, and I mean, I got told by some very experienced MND clinicians, no problem with incontinence, not an issue, don't even need to talk about it. And as time went by, I went, actually, no, this is a problem. Okay, and none of the guidelines mention incontinence. They all talk about bowels and constipation, but they never talk about urinary, continence, and it is an issue. So yeah.
What about the external anal sphincter and problems with fecal incontinence?
Sorry, I didn't quite catch that one. I missed the beginning of what you said. Sorry.
I'm just asking about fecal incontinence.
Okay, fecal incontinence usually It either comes from taking too many laxatives, okay? Your bowels can work a bit over time in MND, okay? And again, you've got all those, I think if you work on the kind of principle, you've got your abdominal muscles, all motor nerves, that fasciculation I talked about earlier that can affect your abdominal muscles. I'm sure that affects your bowels as well. And you do get the odd people with fecal incontinence, much rarer, I have to say. Usually because people have taken too many laxatives or gone overboard on their fibre. But, you know, but pads will control that as well, okay? A lot of those pads that you can get, the very heavy absorbance ones, will manage fecal incontinence as well. You often need, it's useful to have the chair pad, the bed pad in there as a double up just in case. But yeah, it's there, and it's a case of managing it. You can't always fix everything. It's a case of how do you manage it. To answer your question.
Any other questions? No?
No one wants to talk about it, you see. It's one of those subjects. Nobody wants to talk about it.
No, I don't mind talking about it. At the moment, I am still good.
Excellent. Long may it stay that way.
Yeah, I'm hoping it stays that way because I would find it embarrassing.
Yeah.
But, you know, it's like you say, it's a question how you manage it.
Yeah, but I think it's one of those embarrassing subjects that the more you talk about it in relation, I mean, I'm talking about it in relation to MND, the more you talk about it, people get more comfortable in talking about it, that it's a part of MND care. It's about how we need to look after you and how we need to help and support you in your journey with your carers. Yeah.
I don't mind talking about it at all.
Yeah.
It's just what fact of life, what I've got coming in head.
I still say you guys have got it easier than us girls. There's more solutions that you can use for longer than us girls can.
I pity anyone that's going through that. They would have my sympathy, male or female.
Yeah.
Any other questions?
Maybe a comment.
Yep.
It's you commented that the girls are, you know, ill positioned for using some of those things, but guys also have a prostate that grows.
You do, but not every guy has an enlarged prostate. But that's when I came back to that. When I said people that get chronic retention often tend to be the guys with the enlarged prostate. And then it's a case of you've either got to use a catheter because you'll end up with residual that you can't get rid of, or you get dribbling, you get urgency, you get that side of the problem. Yeah. When I was meaning male, female, I was meaning you guys, even with an enlarged prostate, you can use a bottle, which is a lot easier than us girls using those female bottles, because they do tend to dribble. More. Yeah. I didn't quantify that, I apologise.
Okay. All right. Well, if there's no further questions then, I will just say thank you so much, Lois, for your presentation. That was really informative. If anyone does think of any questions and not already connected with Lois, then feel free to message me or send an email to the support groups at mndaq.org.au. And Lois and I speak fairly regularly, so I'm sure I'll have an opportunity to put those questions to her and share the answer.
No problem.
Okay.
Nice to meet you guys. Take care.
Okay, thank
I'll leave
you.
you to it.